Thank you, Koshi. Now, we've been following a campaign by One Big Switch to help Australians find cheaper private health insurance. Annual premiums have doubled in the last 12 years, but despite paying big bucks, many people are confused about what they're actually buying, me included. Christopher Zinn is heading the One Big Switch health insurance campaign. Good morning to you, Chris. Now, the report says people are confused about three things. The first one, how do they know if they can get a government rebate?
Exactly. This is a survey of 58,000 people who are in the switch so far, and 25% of those don't actually know if they're getting a rebate. And actually, if you drill down, there are others who don't know how much it is, particularly in the higher income. So you get a rebate essentially if you're a single earning under 84,000, but there's also age considerations in that. Right. And the point is the government changed it in the start of the financial year. So there's much confusion about this.
Yes.
And it's kind of thing you need to know. 30% off, that's very handy, but if you're claiming it and not deserving it, that could come back to bite you at tax time.
Right, so it's important to check these things
out.
It
is, and look, your health insurance fund can't read your mind. You have to tell them these things.
And you'd be forgiven for not knowing what was going on, because it changes all the time. We'll get a letter in the mail last Friday to say it's changing again. Now, the second issue is the cost of premiums. Where can I find the detail and know that it's right?
Well, exactly. The letter that you got and everyone with health insurance is getting in the next couple of weeks, telling there's a 5.6% on average increase from April the 1st. Look, that's that should remind people what they're actually paying. And again, in the survey, we found 65% of people said it was the cost of cover that actually stopped them going in for this in the first place. So I'd say find out what you're paying, and then you can go to the market and compare. And there's a very good government website, privatehealth.gov.au. This is independent, has comprehensive information. That's the first place I'd go to find what I'm paying and what else the market has.
I'm doing that this afternoon. OK, now the third thing, health insurance discounts. Are they actually available?
They are. Look, if you work in certain banks or certain universities or certain associations, there are discounts. But look, we wanted to make a discount for ordinary Aussies, and that's just by being a part of the big healthinsuranceswitch.com. But really, there is a 12% limit according to the rules on however big a discount could be. This is a very heavily regulated area, but obviously cost is really weighing heavily on those people who want it and can't afford it. In fact, as someone said, the problem with health insurance, I can't afford it, but I can't afford not to be with it. So that's a key point.
That is the problem. OK, Christopher Zinn, great to chat.
Thank you.
Of course, we will put all the details on our website to register for the big health insurance switch. Go to the Sunrise website, follow the links.